Today we're going to talk about the causes and the treatments of thumb arthritis. Well, what causes it? It's generally a wear and tear phenomenon. So you can imagine that you're born with a certain amount of cartilage in this space that keeps the thumb bones separate, or both of these spaces, I should say. Once that cartilage is gone, once it's worn out, you've got bone-on-bone contact. At that point, it's not going to come back. The cartilage isn't going to miraculously grow back to what you had before. So we have to manage what you've got. That's really what causes osteoarthritis. In very simple terms, it's a wear and tear disease, as opposed to inflammatory arthritis, rheumatoid arthritis, where you've got an inflammatory synovium, an inflammatory disease, which makes the cartilage wear out. It's being eaten by an inflammatory process. In osteoarthritis, that's not the case. In osteoarthritis, it's just attrition, it's wearing out, it's slowly being eroded away. Now, if you get into the cellular level of disease, if you looked at the osteoarthritis under a microscope, there are chemicals like metalloproteinases, which are enzymes. There are other small markers in the synovial fluid which tell us that it's not just a mechanical process, there's also a chemical process which takes place. There are changes which occur in the cartilage, in the synovium, in the synovial fluid. But to keep this discussion pretty simple, think of osteoarthritis as a mechanical disease. The cartilage just simply wears out, like getting bald tread on the tyres of your car. And inflammatory arthritis, like rheumatoid and others, is a hostile environment where the inside of the joint is inflamed like it's on fire. And that is typically the more painful of the two as they start. As they equalise and become end stage, they can both be painful conditions. So the pattern of disease is often picked up by a plain X-ray, and we can tell you whether you've got OA or RA just by taking a plain X-ray. Confirmation often in younger people takes a blood test, but we will advise you if that's needed, and it's a really quick, simple test to do. Hope that helps.